Welcome to the Banker Lamp. Please enjoy the video.
You begin by confirming you match the kit's criteria and that you understand timing and risks. Once done, set up a private, comfortable area with a towel, heating pad, glass of water, and your phone within reach. Make sure someone knows how to contact you if needed but not present unless you want company. Read the included leaflet now. When ready, take the first tablet exactly as directed by the kit or your provider. This starts the process and blocks pregnancy hormones. After the first medication works for a set interval, prepare for the second dose per instructions, whether vaginal, sublingual, or oral, because this causes uterine contractions to expel tissue. Once administered, lie down and watch for heavy bleeding and strong cramping. This is expected. Make sure to use pads, not tampons, and time events so you can report duration and severity if needed. If bleeding is light at first, it may increase. Stay hydrated and take pain relief at recommended. Complete the process by resting and watching for the expected pattern. Heavy bleeding and cramping, then gradual reduction over days. Once bleeding lessens and pain eases, you're moving into recovery. Make sure to take any follow-up tests or visit your provider at the recommended interval to confirm completion. If you develop a high fever lasting more than 24 hours, soak more than 2 pads in an hour, faint, or have severe worsening pain, seek emergency care immediately. Those are key warning signs to act on.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.